everyone, it's Dr. King again. I wanted to provide a little bit of a demonstration for what we are looking for with remediation of your proctored ATI exam results. So before I forget to say, when you do your practice exams, you don't need to do a formal remediation where you type anything up. So this is just in reference to what you're going to be doing for the results with the results from your on-campus exam. Okay, so I'm just going to open up one of the practice exam results because that's all I have access to. So again, on your ATI site under assessments, you'll scroll down until you get to RN pharmacology. I'm going to pull up one of my previous attempts for practice exam B. So we'll do the higher score. Sorry, it's taking a minute to load. Okay, so this is what you're going to see when you are reviewing your performance on any ATI exam, either a practice exam or your on-campus exam. It's going to look the same. So this is your individual performance profile page. So a couple things that you're going to see. There is your individual raw score, which is here. So this time I got an 85%. I've taken it a few times and I'm the teacher, so it only took me 11 minutes. It'll take you guys longer, and that's totally fine. There's this download report page, which is important because when you're remediating your on-campus exam, you're going to need to provide a copy of your exam report. So this is where you get that. You'll just download it and submit it on Canvas. And then the way that the ATI site works is it highlights for you how you did on various content areas. So down below here, let me minimize all these for a second. So down below here, it kind of shows you the main content areas on the exam. So management of care, safety and infection control, psychosocial integrity, pharmacological and parenteral therapies, clinical judgment. So these are kind of the main content areas, and it tells you here under topics to review how many different items you missed in that section. So when you open them up, anything with a plus is going to expand and provide you kind of these subheadings to tell you exactly what you missed. So under the concept of information technology, I missed one question, and it's about transcribing a verbal prescription. Whereas under pharmacological and parenteral therapies, I missed 2 questions about dosage calculations and 1 about medication administration. So what I would do if I was doing this assignment is I would kind of just outline all of this so you have it kind of ready to go, because what you're going to be doing is for every single item that you see kind of listed here, like antibiotic administration dosage by weight, that's one item. Determining IV flow rate is another item. All of those need to be remediated. So in total, I'm going to have 1, 2, 3, 4, 5, so it looks like 9 items to remediate. So that way you kind of have a template before you open up your official remediation review area, which is what you're going to click here on review. So before I do that, let me just show you an example of what a document could look like that you'll be typing up your remediation. So this is how I would do it. This is how I think I like outlines. So I essentially just outlined what I just talked about. This is kind of the main concept. This is the subheading, and this is the number of items I missed. This is a specific item I need to remediate, and then for each item, I'm going to write down 3 things that I learned about it after going through the remediation materials that I'll show you in a second that ATI provides. So that way I kind of have an outline of everything that I know I need to remediate, and as I'm going through it, I can just kind of fill it in. So I think that would make it a little bit easier. But I've seen different iterations of this. I've some students do tables. I've seen this organized in a lot of different ways. The main thing that we're looking for is just that you remediate every single, individual item that you missed. Okay, so now if you go to this review button back on ATI, if you click on that, it's going to open up a whole new page here, and again, it's outlining everything that you missed here on the left-hand side. So I have 9 items to remediate, and you can kind of check things off as you go, which I think is really nice within this system. So let's look at where I missed the most. I think clinical judgment. Yeah. So when you click on one of these subheadings, then you have all these little individual headings that you need to remediate. So findings that indicate an adverse reaction. And then you click on kind of the individual item that you missed, and it'll bring you right to the section to learn to read more about it over here on the right. So enoxaparin hemorrhage nursing actions. So this is, I missed something related to that during the exam. So enoxaparin, if it causes hemorrhages, or if it causes a hemorrhage, these are the nursing actions and client education that you need to be aware of. So these are some of the things that you can write down. And you can also supplement with your book, our PowerPoints, and anything else that you need if you feel like you need more than what's here. And once I'm kind of done looking up that item, I'll check it off, and then I'll go to the next one. So let's see, providing education for the client who's prescribed an ACE inhibitor. So it looks like I missed a few things in here. So take captopril at least an hour before meals. The next one was hyperkalemia nursing actions for monitoring. So it kind of just walks you through it and gives you a lot of what you need over here on the right, and you just kind of check them off as you go until you are done. So once these are all kind of checked off, and it's going to be kind of counting for you up here at the top, which I think is really nice. Let me just check off these guys. I think that should be, did I miss one? Yeah, this guy. There you go. So once you're all completed, you've remediated everything that you should do, then this should all be filled out, your 3 points for each item. You should have gotten for either from here or your book or our PowerPoints. Then once this document is complete, you will submit this along with your report that I mentioned earlier. It'll bring us back to the page here in a second. There we go. Along with this download report here that'll show the score, you'll submit that along with your remediation report to get credit for the assignment. Now, one thing I want to point out that looks a little different here compared to what you're going to see when you actually take the real proctored exam is that when you do your practice exams, you're only going to be shown this kind of individual raw score for your achievement on the exam. But when you take the actual proctored exam, you're also going to see a score that indicates a specific proficiency level of pharmacology knowledge. And that's based in part on your individual score, but also comparing your score to kind of the national average for students that are kind of at your level. And you'll be ranked, level 3 is the highest. Pretty hard to achieve a level 3. I think you have to be in like the 95th or above percentile to achieve that. So level 3 is like exceeds expectations. Level 2 is you're proficient. Level 1 is you're partially proficient, and then below level 1 is you're not proficient in your pharmacology knowledge. And based on what level you're at, you're going to have more things to remediate. So as you can see, I got an 85%, and I had 9 items to remediate. If you score a 50%, you're going to have a lot longer list to remediate. So that's kind of why the scoring is the way it is when you look at the rubric in the assessment, on the assignments page for ATI. Because if you score lower on the exam, then you're going to have to do more remediation. So your remediation is worth more points because that's kind of where your effort is going to lie. Versus if you ace the exam, you're only going to have to remediate a couple items. So you only get a few points for that. But all in all, in total, between your exam and your remediation, the point value for this assignment is 10 points. So it may seem scary, but it's not worth a ton. Your exams based on content, like our normal 5 exams, are worth a lot more. This is just meant to be kind of a dry run, so you get a chance to practice taking an exam with boards style questions about pharmacology, and you get a chance to kind of learn how to remediate and review kind of what you got wrong, so you can be stronger the next time that you take a pharmacology exam. So hopefully that is helpful. Let your professors know if you have any questions about remediation, and just make sure you pay attention to due dates. It's due later in the semester, but that can be a busy time of the semester, towards the end when holidays pop up and you're getting excited about being done. So make sure you don't forget about it. It's a good experience. Just let us know if you have any questions. All right, talk to you later.